So good morning, everybody, or afternoon, or wherever you are. It's kind of strange teaching these things and all across the time zones. Some of you may know me, some of you don't. My name's Tim Hutton. I am an instructor for the Upledger Institute. I'm a massage therapist. I've been doing cranial work since 1994. Been teaching since about 2000. And over the years, I've taught a wide variety of courses for the Institute. I've taught Cranial 1, Cranial 2, SCR 1, Advanced, The Brain Speaks. But now I'm mostly concentrating on the immune response curriculum. And I'm the ombudsperson for that curriculum. And what I wanted to do was do a short presentation to kind of get people a little familiar with the immune response stuff. So if they're interested, they might know where to go and what courses to look for. So before I dive into that, I'd like to introduce another of our instructors, Karen Axelrod, who's on the call, and she is also teaching immune response classes. Karen.
Hi, everyone. Nice to see a lot of familiar faces and familiar names on the call. I'm Karen Axelrod, and I'm in Los Angeles, California, and I teach CranioSacral 1 and 2. I teach CranioSacral therapy for cranial nerves. I teach clinical applications classes, and I also teach the first level immune response class, the CranioSacral therapy and the immune response. And I just want to say just right off the bat when I first took the class with Dr. Upledger well over a decade ago, started assisting it and then became an instructor for it, I found that I bring this immune system work into my practice virtually every single time. Every single session has some element of either working with inflammation or working with some aspect of the immune system, because as Tim's going to tell you, inflammation is one of the key drivers that is driving disease and illness in most people's bodies these days. And I have just found that it's one reason why I wanted to come teach the class too, because I think it's a really important class, really important material to learn. And I think you're going to enjoy the presentation today and really find that if you dive into this curriculum with us, you're going to really find that it changes your practice. So happy to be here and see some familiar faces.
Great.
Thanks, Tim.
Thank you, Karen. Appreciate it. And it's a good segue exactly for what I wanted to talk about next. So first question you might want to ask is, why would I be interested in learning how to treat the immune system, learning how to deal with the immune system? And the short answer, as Karen pointed out, is that the immune system is involved in every single session that we treat as craniosacral therapists. Because if there are symptoms, the person is experiencing some symptoms, then there is some inflammation and the immune system's involved. That involvement may be secondary. You might have a fascial restriction or an energy cyst that's causing some problems that's resulting in a little bit of inflammation, or it can be primary. You know, Karen mentioned chronic inflammation, and chronic inflammation is a situation where the immune response is inappropriate. And you've got this long-term process of the body constantly tearing itself apart and trying to rebuild itself, and tearing itself apart and trying to rebuild itself. And chronic inflammation is the driver for most of the chronic disease, for the lifestyle diseases that we see in our culture. Diabetes, obesity, heart disease, kidney disease, arthritis, autoimmune disease, all of that stuff can be laid at the feet of chronic inflammation. And cancer is often involves the immune system, and if it doesn't, if we can get the immune system involved in the cancer, maybe the immune system can help the body to get rid of the cancer. You can also have illness, of course. You could have a bacterial infection, or you could have COVID-19, right? Which is the illness caused by the SARS-CoV-2 virus that we're all dealing with right now. And so having an ability to engage with and work with and enhance the functioning of the immune system is a big resource that you can have in your toolbox that you can be working with your clients. So let me start with my presentation here. Actually, I need to go back. There we go. So this little presentation is an introduction and overview to the entire immune response curriculum. And as we'll see in a minute, there's several different classes in this curriculum. And I wanted to go over them and tell you what the options were. I love this quote. Eden Phillpotts was an English novelist, but this quote just seems to be so apropos to the work that we do. Whenever you put your hands on the body, there is so much information coming into your hands. And it's just a question of us getting soft enough and quiet enough so that we're able to perceive it. So there's a picture of John Upledger for those of you that have never met him. John's craniosacral career spanned about 30 years, from about 1975 or so to about 2005. And the early years, the late 70s, early 80s, was when he was developing the very structural material that you learn in Cranial 1 and Cranial 2, all about the craniosacral system and the dura and so on. And then as he was doing all that, he started to notice that under certain conditions, the body will naturally go into a spontaneous release process where it just starts to let go of its trauma. And out of that came the CSIR and the advanced curriculums. And as he continued towards the latter part of his career, Dr. John was very interested in parts of the body that were very complex, that had a lot of room for miscommunication, for conflict. And the two parts of the body that he felt fit into that category were the brain and the immune system. And out of that, he developed two courses. One is called the Brain Speaks. It's now called Brain Speaks 1 because there's a Brain Speaks 2 now that's been developed, where you're working with all the various structures within the central nervous system. And then the immune response class, which he just called the craniosacral immune response, where you do the same thing with the immune system. And that was really the last course that he developed in his career. Two things struck, well, Dr. John was an amazing man and he did a lot of stuff. But the two things that I think really struck me about his genius was, first of all, his awareness and discovery, I guess you would call it, of the CSIR process and the importance of the inner wisdom. Sometimes he called it the inner physician, that really controls and understands and does all the release that happens in the tissue. And just recognizing that CSIR process is the crown jewel of all of his work. It by far is the most amazing piece. And the one thing that struck me about Dr. John was his trust in that process. His trust was absolute. He would put his hands on the person, and wherever they went in their process, he was happy to go there with them. And that is one of the reasons why he got such great results, I think, with his treatment. But there was a second piece about his work that really struck me when I used to watch him treat, and that was his focus on the tissue and his specificity. His knowledge of anatomy was immense, and he would put his hands on, he knew exactly where his intention was, and he knew exactly what was under his hand. And he could work with it on a very minute, on a microscopic level, actually, because his knowledge about chemistry was really huge as well. And that, I think, was the second secret to his success, was he was so precise and so specific when he worked with clients that the inner wisdom really felt listened to in exactly what the inner wisdom was trying to show Dr. John was what he ended up paying attention to, basically. So his approach is sort of unique in manual therapy that I'm aware of. There's less focus on technique. And it's true that if you're beginning and you're studying Cranial 1 and Cranial 2, you're going to be learning a lot of technique. You're going to be learning hand positions, protocols. That starts to fall away as you get into the more upper level classes and upper level approach to the work. It's not that we let go of technique completely, but it sort of comes in and out of the treatment. And there's much more focus on simply paying attention to the healing process of the client. You know, John's idea of the inner wisdom is that the inner wisdom knows what the problems are, knows how they got to be that way, knows what needs to happen in order to release, knows what resources are necessary for that, knows when the appropriate time is for that release to occur, and then controls the release. And so if instead of us doing things to the client, we say, okay, inner wisdom, I'm willing to be here with you. What do you want? How can I support you in whatever process you want to go through? That becomes a very powerful approach and a very efficient approach, because the inner wisdom is the one that knows the most efficient way to get from A to B. So if I'm in there doing things, I'm probably not doing it in that most efficient way. If, however, I'm following the inner wisdom, things move very smoothly and it actually goes precisely where the inner wisdom wants things to go. So cranial work becomes much more a process of being with the client as they go through their process than something about doing to the client technique that I think they need, basically. So the therapist, instead of someone who is responsible for the outcome and treating the client, becomes a neutral witness to that process. And an analogy that I use a lot when I treat or when I teach about treating is I'm listening to a symphony orchestra. There's this whole orchestra movement that's happening within the client. My job is to play the role of the audience. And that role is incredibly important. I mean, what is a symphony performance without the audience? It's a bunch of people getting together to play music, or it's a rehearsal, but it lacks the power and majesty of the ritual of everybody getting dressed up and going to a night at the symphony. And so there's something really special that happens when you have that audience. And notice that the symphony waits to play until the audience shows up. And the same thing is true with cranial work. When I put my hands on and I'm listening, I'm enabling the inner wisdom to go along this journey that allows them to move through their process. And as I said, Dr. John had an immense knowledge of anatomy, but the anatomy that you need in order to do things from this cranial perspective is different than the anatomy that you need from a more technique-oriented approach. Like for instance, in visceral manipulation, which tends to be a little more technique-oriented than CranioSacral therapy, landmarks are very important. You need to apply your technique to the client. You need to know where to do that technique. If you don't have your hands in the right place, it's not going to work very well. The difference in CranioSacral therapy is landmarks are irrelevant. You can treat any part of the body from any other part of the body. So you, for instance, might be treating someday someone who's in the hospital or in hospice, and they've got tubes plugged into them, and the only access you have to their body is to lay your hand on their arm. And you can treat their entire body from that position of your hand on their arm, because it's much more about where you put your intention, not about where you put your hands. So that means we need a different understanding of anatomy. We don't need landmarks. What we need to do is understand how to perceive texture and energetic quality so that we can let our intention and awareness move through the body and just recognize where we are. It's like, oh, that's an artery. There's the blood inside the artery. There's the lining of the artery. There's the nerve along the artery, and so on. And there are several classes now in the upper curriculum that teach this kind of very general anatomy, a generalist anatomy, let's call it. And there's the glial classes that Tad Wanver developed. Those are very powerful, working in conjunction with the Brain Speaks class to work at the central nervous system. There's the cranial nerve classes that Karen Axelrod developed, looking at all the nerves, particularly that coming in through the head. And there's the Brain Speaks class that Dr. John developed. And then there's the immune response curriculum. And there's probably some other classes that I am forgetting to mention here. But these are all focused on learning to be very specific with your treatment, learning the anatomy and learning to perceive and palpate that anatomy so that you can really follow what the inner wisdom is asking you to pay attention to. So the immune response, the basic immune response curriculum consists of 5 classes. The basic class is the immune response class, CSIR, and the prerequisite for that is SER1. And in the CSIR class, you learn the anatomy and physiology of the immune system. Then there are 4 more classes that all have CSIR as a prerequisite that can be taken in any order. And they focus on different parts of the body. 1 class on the thorax, 1 class on the abdomen, 1 class on the pelvis, 1 class on the extremities. And in each of these cases, let's go back to the basic CSIR class. You learn the anatomy and physiology of the immune system, and you learn to palpate the immune system directly. And at the end of this little presentation, I'm going to do a little practice session and show you how to do that. You also learn to map inflammation. You learn to tell precisely where in the body is there inflammation, what parts of the immune system are involved in that inflammation. Is it chronic or acute? to some degree, what is it that the immune system is responding to that is causing the inflammation to be there. You learn to dialogue with the immune system and work with it in that way. And all of these are very powerful tools that you can use to approach your treatment and expand your treatment. And as I mentioned, the prerequisite for CSIR is the SER1 class. The other 4 classes on the various parts of the body, thorax, abdomen, pelvis, extremities, in each of those classes, you learn the detailed anatomy of that area of the body. So for instance, in the thorax class, you learn the rib cage, the muscles, the membrane system, all the arteries, veins, nerves, lymphatic vessels, the organs, which in that case is the lungs and the heart, the thymus, and you learn to palpate all of those things very specifically. And the main focus of the class is how does chronic inflammation affect that part of the body? So with the thorax class, a lot of the focus is on heart and lung disease. Heart disease is the #1 killer in the United States, right? So if we can, and someone has a heart attack, they don't just out of the blue have a heart attack. There's some chronic inflammation usually that has preceded that heart attack for years. And if we can go and help treat that chronic inflammation and reduce it a little bit, maybe we can delay or prevent the heart attack down the road, right? Abdomen, so many ways you can get chronic inflammation in the abdomen, but the primary focus is on leaky gut. Leaky gut is what happens when the lining of the small intestine gets inflamed and starts to lose its integrity. The small intestine's job is to break down proteins into their component amino acid building blocks that then pass across the lining of the small intestine into the bloodstream and are used as fuel for your body to make its own proteins, basically. But if the lining gets damaged, then partially digested protein fragments that should not get across that membrane get out into the bloodstream. And then they end up causing problems elsewhere in the body. So they've shown, for instance, that you pretty much cannot have autoimmune disease if you don't have leaky gut first. So that's a huge component of a lot of the chronic diseases that people experience. Pelvis, so many ways that you can have pelvis inflammation, just structurally through the hips and low back, reproductive issues, kidney bladder issues, irritable bowel, all those things. And the extremities are extremely important. How many of your clients have problems in the extremities, either sore knees or ankles or hip problems or tennis elbow or shoulder restrictions? So all of these courses, once you take these 4 courses, and then if you take something like the Brain Speaks or the Glial class, and then the Immune Response class at the same time, you will have developed a awareness of the anatomy of the entire body from a craniosacral perspective that is immediately applicable to your cranial treatments. You know, I learned my anatomy by studying visceral manipulation and mechanical link. Mechanical link is another osteopathic approach taught by Paul Chauffeur, who's from France. Both very powerful approaches. I love them, I use them, but very, very different from craniosacral therapy. And it took me years to figure out how to apply the anatomy knowledge I learned in those curriculums to my craniosacral practice, because I think of myself primarily as a craniosacral therapist. And that was a real struggle for me. But here's a way that you can learn the anatomy directly from a craniosacral perspective that's immediately applicable to your practice, if that's how you choose you want to go with it. So there's another class in the curriculum that I'll just mention, and that's a clinical applications class. Clinical applications classes are small classes that are taught in someone's office, in their clinic, with something where between 4 and 6 people. So a very small class, lots of one-on-one interaction with the instructor. Clinical setting, meaning that you are treating each other and treating clients under the supervision of the instructor. And the instructor has their hands on every session. So they're giving you lots of very detailed field feedback about what's happening. You know, did you feel that? Oh, the significance sector just changed. Don't you feel that tension that just appeared? So you get to learn the tricks of the trade by studying with a particular instructor doing clinical applications classes. And there's a bunch of different levels of clinical applications classes. And it's a class that you can take many different times from different instructors and get totally different things out of them, because everybody does this work differently, right? But there is a clinical applications class that I teach, and I believe Karen teaches it as well, that is focused on applications of the immune response specifically. And so that's an option once you've taken the CSIR class as well. Oops, I think I skipped a slide. So let's ask this question. We're talking about the immune system. What is the immune system? Well, a system, anatomy-wise, is a group of tissues that work together to perform a function in the body. So for instance, the circulatory system is all the parts of the body that circulate the blood. Respiratory system is the part that's involved in breathing. So the immune system is the part that's involved in protecting us from harm. And the immune system is a loose network of somewhere between 10 and 50 billion cells, and their molecules that they use to communicate with, and so on, all communicating with each other chemically, energetically, that works together as a team to protect us from harm. So we talked about 10 to 50 billion cells. People generally don't have very good concept of large numbers. It's very difficult for human beings to have that. And so just to give you an example of what do I mean by 10 to 50 billion cells? Well, for comparison, we all know what a second is, right? In time. So a million seconds is about 11.5 days. A billion seconds is 32 years. 10 to 50 billion seconds is somewhere between 320 and 1600 years. There's 10 trillion cells, human cells in the human body. So there's about 1,000 times that many cells that aren't immune cells. But you see 1 out of every 1,000 cells in the human body is an immune cell. That's a fairly big number, actually. So huge number of cells, all working together in a very efficient way to protect us from harm. So what does the immune system do? Well, protecting us from harm means protecting us from things that get in from the outside in particular, so viruses, bacteria, parasites, and so on. But so that's its big job, but it also causes inflammation. We talk a lot about inflammation, and we should define it. Inflammation is the action of the immune system. It is what the immune system does. When the immune system gets ramped up, that's what we call inflammation. And the symptoms that you experience externally, heat, swelling, redness, pain, all come from the fact that the immune cells are getting out into the tissue, and there's a lot of fluid getting in out there as well. And that's starting to cause us some symptoms as it does its work, right? So inflammation is not a bad thing. Inflammation is, in fact, a very good thing. It's something that we want to have happen when it is appropriate. If I get a bacteria, or I get a parasite, or I get a virus, I want my immune system to respond to that. That would be what I would call acute inflammation. That's the immune system working appropriately. But it can also have a situation where, for a number of reasons, the immune system gets caught in a loop. And I get this chronic inflammatory process where instead of the process resolving itself and us healing, the body is tearing itself apart and rebuilding itself and tearing itself apart and rebuilding itself. And that's what we would call chronic inflammation. That's not what we want. And that's the thing that causes so many problems for us health-wise, and that we can treat using CranioSacral therapy. So there's a big connection between the immune system and the rest of the body, and in particular between what you learn in SER classes, because if the immune system is protecting me from harm, questions come up about what is me, right? What is self? How do I distinguish self from non-self? Because I don't want to be attacking myself. If I get confused about something being self versus non-self, I might attack the wrong thing. So what does it mean to have a boundary? What is that nature of that boundary? Is it appropriate? Is it too thin? Is it too thick? You know, you can have situations where I don't let anything in because I'm so afraid of the outer world, but I have this huge thick boundary, or I can have a boundary that's too porous. And so can I recognize things from the outside world that are harmful? Or do I make an inappropriate judgment of that, right? So a lot of the psychological things that we associate with human beings as a whole also occur on a microscopic level. So cells have the same kind of emotional, psychological issues as a human being as a whole. So for instance, major belief systems that somebody has, if they have a belief system that the world is a very dangerous place and it's constantly getting ready to attack them and they have to do something about it and stay vigilant all the time, their immune system may well carry that same idea and that same view of the world. In that case, anytime something comes in, the first response of the immune system is going to be to attack it. And the immune system is going to spend a lot of time and energy attacking things that maybe it doesn't need to attack. And in addition, there's the possibility that the immune system might mistake something that is actually self for something that's harmful from the outside world, and then you get autoimmune disease. So someone who has that view of the world as being very dangerous and I'm just going to attack anything that comes in, they're going to be more prone to autoimmune disease. At the other end of this extreme, you can have people who have this sort of Pollyanna view of the world that, oh, the world's a wonderful place and we just all need to love each other and it'll be great. And their boundary is too porous and they don't react, and something really harmful may come in and they get hit by a truck. So you start to learn to work with these sort of emotional levels and idea belief system levels about the immune system. And this is the correlation between the immune response class basically and the SCR curriculum. So we talk about boundary and the need to protect the boundary so that things don't come in that are inappropriate. And so that boundary is the first layer of defense of the immune system, is the actual physical boundary itself between us and the outside world. And we're pretty aware of the skin, you know, that's the outside of our body that we notice about there. And skin has about 2 square meters, you know, so 2 square yards basically of surface area. But there's a boundary on the inside as well, and that is the mucous membranes. If you think of this, topologically, the structure of the body is like a donut, right? It's a solid body with a hole that runs all the way through the middle of it, and that is your digestive tract. And that lining of the digestive tract is actually part of the outside of your body, because you put food and other things in your mouth and it goes through, and you could be putting anything in your mouth, right? So that mucous membrane is part of that physical outside boundary of the body. And we have 2 square meters of skin. We have 400 square meters of mucous membranes in the body. 400 square meters is roughly the size of a tennis court. Huge. Now, 100 square meters of that is in the lungs, about 300 of that is in the gut, and there's a small amount in the urogenital area in the eyes. That is a huge surface area that has to be protected because anything could come across any part of that boundary at any time, right? So of those 10 to 50 billion cells of the immune system, 70 to 80% of them are guarding the gut, because that is the most likely place where you're going to get things coming across. And they sit underneath that lining of the immune system, of the mucous membrane, waiting, those immune cells waiting for something to come across. If something comes across, they activate, and then they start attacking or doing whatever they need to do to protect that area and then get it to heal again. Immune system cells are found elsewhere as well, and if you take the CSIR class, we spend a lot of time talking about where they're found and where they're not. But typically, if there's no inflammation, they are not found in the rest of the tissues of the body. They're not in the interstitial spaces between the cells. And the reason for that is that the most dangerous thing to our bodies by far is our own immune system. If our immune system goes haywire, it could just rip our body apart in minutes. And so as a protection against that, there's several layers of protection against that. But one of the ways that we're protected is the immune cells are confined to certain pathways and not others. And because they're confined that way, there's certain proteins that are on the surfaces of our cells that they typically don't see. Unless there's inflammation, they get out into the tissue. If there's an injury or something, then they'll start to get out in the tissue and then they'll start seeing those proteins. But if they never see those proteins, there's no chance they can react to them. And so it's a protection against autoimmune disease. So Once immune cells get activated, there's all kinds of things they can do. They can examine and test the surfaces of cells to see if there's anything going wrong in a cell. They can examine the things they find in the environment and show them to other cells and say, what do you think of this? Is this something we need to react to? If there is something they feel like they need to react to, they can bind with it. And in binding with it, that can neutralize that pathogen. If the pathogen is small, they can gobble it up and digest it down to its component parts. That's a process called phagocytosis. They can also kill organisms, punch holes in them, dump poison next to them. There's a whole quiver of different options that they can explore, tools that they have in their tool bag. And most importantly, they work as a team. So everything is working together to get rid of this harmful whatever pathogen, whatever has come in, and then heal the body as a result. And I wanted to show you a quick little video of some immune cells reacting to a bacteria. And the main thing I would like you to notice is how dynamic this is. Some of this video is animation, but other parts of it is actually filmed under a microscope. And you can actually see how fast things happen at this level and how dynamic it is. So let me switch to the video. So this is an immune cell gobbling up bacteria. This is all animation, but the other was actual film of the immune cells gobbling the bacteria. So as you can see how fast those immune cells work and are able to engage with their environment. Things happen very, very quickly on a microscopic level. And imagine being able to palpate those macrophages doing what they were just doing on the bacteria. Now you can't palpate a single macrophage, at least I can't, but there's not a single macrophage doing that. If there's that process going on, there's millions of them. And that's a tissue, and you can palpate that process of the macrophages gobbling up the bacteria or whatever, just as you can palpate anything else in the body. So I want to show you a little bit about how to do that. So let me start my share screen again. So palpating the immune system, how do we go about that? Well, let's talk about palpation in general. And when I talk about palpation from a cranial perspective, I mean palpating the craniosacral rhythm. So the first question is, what causes the craniosacral rhythm? And if you remember from your Cranial 1 class, it all goes back to something called the pressure stat model. And the pressure stat model is how the body controls the cerebrospinal fluid pressure in the brain and spinal cord. It's very important that that cerebrospinal fluid pressure fall between two very narrow limits. And the way the body does that is that the fluid, the cerebrospinal fluid, is constantly being drained away, but it's being produced intermittently. So the production is faster than the draining process. So when the production is on, the volume of fluid starts to increase and the pressure inside the head rises. That causes the skull to expand. And eventually there's a stretching that happens in the sagittal suture. And there's stretch receptors in that suture that eventually say, okay, that's enough fluid pressure. sends a signal to the choroid plexus and says, turn off the fluid production. So the fluid production turns off, but the fluid is still draining away, so the pressure in the head starts to drop very slowly. And eventually that sagittal suture comes together, and there's pressure receptors there that tell the body, okay, we need more fluid, turns the fluid production back on again. And that fluid production cycles on and off, causing the head to expand and contract very slowly all the time, with a period of 5 to 10 seconds. Okay, and that's the basic cranial rhythm that we feel. Now, it makes a lot of sense why I can feel that when I have my hands on the head, because I have my hands directly on the water balloon, I'm feeling the water balloon expand and contract. But we can also feel the cranial rhythm in the rest of the body. We can feel it in the extremities, for instance. Why do we feel the cranial rhythm in the extremities? Well, the reason turns out to be that when the pressure rises, it causes a little bit of stimulation of the motor cortex. The motor cortex is the part of the cortex right here under the parietal, basically. And when the motor cortex gets stimulated, it tells all the muscles in the body to tighten slightly. And when you tell all the muscles to tighten ever so slightly, everything externally rotates, because the external rotators are more powerful than the internal ones. So in flexion, that causes the body to rotate outwards. Then as the pressure drops, everything relaxes again, and the body rotates inwards again. So that means it's the muscles of the body that are pulling the body into flexion and extension and causing that external and internal rotation that we experience. So if the muscles are pulling the body into those external rotation, internal rotation, it's pulling all of the body in those positions, right? So I can feel that globally as the structure, like we do in listening stations, the thighs are moving, the abdomen's moving, the chest is moving, so on. But it also pulls all the little parts, right? So I can look at it on a macroscopic scale, I can look at it on a microscopic scale, and every little piece of the body is going along for the ride. So that means that this is the key principle. Every part of the body, every aspect of the body should move with good SQAR in the craniosacral rhythm. That's the muscles, the blood vessels, the nerves, the bones, the organs, the blood, the energy field. Everything is being moved into external rotation and then internal rotation. And if I start to get very specific about what I'm noticing, I can feel what's moving and what isn't. And that also includes the cells of the immune system, right? So let's do a little quick exercise to just kind of show you what this feels like. And I want to come back to a point I made about when I was talking about the immune system in general, that the immune system is a loose network of 10 to 50 billion cells. I can think of it as a tissue, but it's a different tissue from the tissues of the rest of the body, because if I look at a muscle, all the cells in the muscle are packed tightly together. If I look at a kidney, all the cells of the kidney are packed tightly together inside this little membrane, right? So it's like a solid. Everything has its integrity. The immune system is much more like a network. All the cells are spread out apart from each other. They're still interacting, they're still communicating, but they're not packed tightly together in one place. So they're less dense than, say, a muscle or a bone or an organ or the fluid of the body, right? And so if I'm palpating it, I will feel something that feels a little bit more like a network or a web than if I'm feeling something that's really solid. So let's do a little exercise here, just to give you hopefully give you a sense of this. So just relax in your chair or lying down or wherever you are, get comfortable. Notice your breathing. Feel the weight of your body as you're sitting or lying there, whatever you're doing. Let your breathing become natural. Don't force it in any way, but just notice it. So you start to go internal, start to become aware of your own body, and start to be able to palpate what's happening in your body. And let's use your abdomen as a place to explore, because it's a nice, convenient place. So put your hands gently on your abdomen. And thinking back to Cranial 1 and listening stations, I want you to just tune in to the movement of the abdomen in general in response to the cranial rhythm. So if there's no problems there, hopefully you're going to be feeling the abdomen doing a gentle external rotation, internal rotation as it goes into flexion, goes into extension. And what I want you to notice about that movement is that the thing that is moving under your hands feels fairly solid and dense. You're feeling the muscle, right? So this is a dense thing, solid thing that's moving. Now I want you to bring your hands a couple of inches off the body, and I want you to tune into your energy field. Now the energy field gets externally rotated and internally rotated just like everything else in flexion extension. So relax your hands really well and start to see if you can feel the external rotation and internal rotation of that energy field as it responds to the cranial rhythm. It's a little bit harder to feel. It's more ephemeral. It's not going to have the same quality of something that's solid and dense that's moving under your hands. It's going to feel like a cloud that's very gently drifting out into external rotation, drifting back in into internal rotation. It's very ephemeral. Okay. Then put your hands back on the abdomen and feel the solidness of the tissue. And again, compare it to that ephemeral cloud-like quality of the energy field. Now, there's energy field inside the body, just like there's energy field outside the body. So with your hands on the abdomen, tune into the energy field inside the abdomen. You're still feeling external rotation, internal rotation. You're still going to be feeling energy field. So now I'm going to tune into that sort of ephemeral cloud-like quality. All right, now my hands are in the same place. I'm palpating things that are overlapping each other in the same place. It depends on what I choose to pay attention to. I'm listening to that symphony orchestra, right? So if I choose to pay attention to the tissue, I feel that dense, solid quality of movement under my hands. If I choose to pay attention to the energy field, I feel this very cloud-like ephemeral movement. So I'm feeling the density of the thing that's moving that I'm paying attention to. So now let's change our attention once more. Sitting right under the skin of your abdomen are a bunch of immune cells. In this case, they're called macrophages, but you don't need to really worry about that. And they're sentinel cells, and they're sitting under the skin, waiting. They kind of are garbage collectors and cleaning up and detoxifying things, but they're waiting there in case you cut yourself or some bacteria gets in across that boundary. And if that was to happen, they would activate and would deal with it and help kill it, and then you can heal and everything. So tune into those immune cells that are sitting right under your skin and feel how they are moving in response to the cranial rhythm. Now, I'm not feeling a single immune cell. I'm feeling millions of them. So it's no different than feeling the tissue of the abdomen, the muscle. It's just that the immune cells are spread out from each other a little bit, right? So feel those immune cells and notice what the density of that tissue feels like, right? When you tune into the muscle of the abdomen, it felt very dense. When you tune into the energy field, it felt very ephemeral. To me, the immune system feels halfway in between. The cells aren't packed tightly together like they are in the muscle. They're spread out, but they are physical cells, so it has more solidity than the energy field does. That characteristic of cells that you're palpating that has that apparent density halfway between tissue and energy field is characteristic of the immune system. So continue to feel those immune cells as you're feeling right under the skin. And now, still thinking immune cells, I want you to put your awareness deep in the muscle of the abdomen and feel for the movement of immune cells deep in the abdomen. Now, what happened to the cranial rhythm? Probably the rhythm just disappeared. And the reason is there's no immune cells in the muscles of the abdomen, unless there's something going on there. If you do feel a lot of immune activity there, then you have some inflammation in that muscle. but there's no immune cells there. Now I could tune into the movement of the muscle itself, that moves in the cranial rhythm, but there's no immune cells there for me to feel. So if I'm thinking immune cells and intending immune cells, I don't actually feel immune cell movement. Now, still thinking immune cells, I want you to put your awareness all the way down into the lining of your small intestine. Just keep going in until you feel like you're at the lining of the small intestine and you're feeling for immune cells moving in the cranial rhythm. And unless you have a lot of inflammation in the abdomen, what's going to happen is that cranial rhythm will reappear because there's a ton of immune cells lining the small intestine. Now, if you have some inflammation, you may find you're not going to feel a lot of rhythm there because they're not moving well in the cranial rhythm because they're stuck. But generally speaking, it's what you ideally would like to feel is immune cells moving on the surface, under the skin, no immune cells inside the abdomen, and then tons of immune cells lining the small intestine. Now, it takes a certain amount of practice to be able to feel all of this and to interpret it. There's many different kinds of immune cells. You can learn to distinguish them one from another and so on. But that's a start. That gives you a basic idea of what it means to start to work with and palpate the immune system. Once you get good at this, you can just, by knowing where the immune cells are, how they feel energetically, do they feel resting, do they feel activated, do they feel stuck, do they feel compromised, where are the immune cells versus where there should be under normal circumstances. You can learn a lot about how the body's inflammation is going, what the immune system is responding to. Is it an autoimmune disease? Is it not an autoimmune disease? And so on. So enormous amount of information available about the immune system just by palpating the craniosacral rhythm. So that's my presentation, and I'd like to have a little question and answer session and happy to answer any of your questions about the immune curriculum or anything in general.
Hi, thank you for this class. How do you sell this to clients? I understand it and I believe in it, but I'm wondering, it just seems kind of out there for a client.
You're speaking of craniosacral therapy in general or the immune in particular?
The immune component.
I don't necessarily sell it because I mean, if they're willing to get on my table, we're just doing craniosacral therapy. I don't necessarily talk about everything that I'm palpating under my hands, right? And it's, as a massage therapist, I can't diagnose, so it's inappropriate for me to say, oh, you have, obviously this kind of infection going on or whatever. That would be something I wouldn't want to share. So I think a lot of times it doesn't come up. I mean, I can certainly speak very generally in terms of it feels like there's a certain amount of inflammation here. It feels irritated. It feels things like that. But I'm not necessarily going to sell it. Now, if the person I'm working with is open to imagery work and dialogue, and they sort of go there on their own, and we're working with images around the immune system, well, that's another thing. Then we're talking about it. They're coming up with it on their own, and I can confirm what I'm feeling under my hands that responds to what they're coming up with their imagery. I mean, remember, one of the basic principles of craniosacral therapy is that we don't share projected imagery. So if I'm perceiving something in their tissue, other than very general things about, oh, this feels tight, it's not stuck, it's not moving here really well, I'm not going to be getting into a lot of detail about what it is I'm feeling because I don't want to project onto them and be inappropriate. Does that make sense? Yeah. Another question.
It's nice to meet you virtually.
Yes.
I'm looking forward to taking all these classes. At some point, I'm a little frustrated right now because I don't have SER, and I just want to jump right in here to the immune.
I know the feeling. The classes can be very addictive. It's like they get so excited, but yes, yeah.
But during your demo, a question came up for me. It was quite amazing the way you led us through this because I was skeptical at first, and there it was. What happened when you asked us to tune in to the lining of the gut itself? What seemed to happen was bilaterally it became asymmetrical, as in it was quite noticeable that all of a sudden the rhythm was a lot less strong on one side than on the other.
Okay. Which
Is
side?
that left?
Okay.
Left was weaker. So you know, liver, something's going on.
Small
But
intestine more likely, but okay.
yeah. Is that the kind of thing, just a general question in terms of the class, is that the kind of thing that we would learn how to interpret as significant, insignificant, or is that part of the process of interpretation? Is the question.
Precisely. That's exactly it. So when you're tuning into those, remember the basic principle is that everything in the body, every little part should move with good SQAR in the cranial rhythm. So now I tune into the abdomen and I tune into specifically into the immune cells lining the small intestine. And I notice that on the right side, which is the ileum, they're moving really well. I notice on the left side, which is the jejunum, man, they're not moving so good. That means there's some chronic inflammation in and around the jejunum aspect of the lining of that part of the small intestine. So yeah, that's precisely what we tune into. Right, and then I could also compare how the immune cells are moving to how the lining itself is moving. I could start to get more specific about which immune cells are not moving so well. But that probably means you have a little bit of chronic inflammation on that side of your small intestine, which is very common. I mean, most people have some degree of that.
So what I hear you saying is that knowledge of detailed anatomy is crucial to this part of the work.
It is, crucial is a strong word. The inner wisdom is able to make use of whatever resources we present to it. And you can have somebody, I mean, we have a program teaching cranial work to first graders, right? Where they're taught how to do basic energy work and they don't know they can't do it. They put their hands on and wonderful things happen. So inner wisdom will make good use of whatever resources you present. But the more knowledge of anatomy and precision and specificity you're able to bring to the table, the more resources you can support the inner wisdom with. And so it greatly expands the capability of what you're able to do. Yeah.
Thank you for your answer. That's great.
Welcome. Thank you.
Yes, and thank you. Nice to meet you virtually. I've heard so much about you, so I look forward to being in an in-person class sometime soon. I have a question about your explanation of why we feel the extremity movement in relation to the craniosacral rhythm.
Yep.
So what I think I heard you say was that the pressure rises, and then that causes a little pressure on the motor cortex, and our external rotators are stronger, so that's why we're seeing that.
Yes.
But when I consider the lower extremities, I totally see that. But when I consider the arms, you know, we've got our pecs and lats doing internal, and you know, we don't have such large muscle groups doing external. So I'm just trying to permeate that through the whole body and get that. Because I totally agree. I feel it. I agree. I totally feel it.
Yeah, and I don't know of the exact kinesiology details as to why it occurs, but I agree. I mean, I feel it, so I know it's there, and the reason we say that the other possible explanation is fascial integrity, right? So if I've got the craniosacral system causing this movement, it could be that just the fascial connectivity is causing this whole process to move in the cranial rhythm. Except that we know that if someone has a complete severing of the spinal cord, there will be no cranial rhythm in their body below the level innervated by the last intact segment. So that means it's got to be neurological. So if you're ever working with someone who's paraplegic, and it's actually a nice little palpation tool, because you can have, if you have them on the table and you put your hands on their feet, if they have a complete spinal cord injury, and usually people with spinal cord injuries, their diagnosis is either complete or incomplete.
Mhm.
And it's an important distinction because complete means your spinal cord is severed. There's nothing we can do for you. Here's a wheelchair. This is how to learn how to use it, right? If it's diagnosed as incomplete, it's, oh, you're still getting some signal. Let's do some rehab and see what we can gain, right? So if you have someone who is diagnosed as a complete spinal cord injury, you put your hands on their feet, you should feel no cranial rhythm. It'll just feel very quiet and passive. I have had cases a few times of treating people with complete spinal cord injuries or diagnosed as complete spinal cord injuries. I put my hands on their feet and all of a sudden I feel cranial rhythm, which means that the signal is getting through. There's not a complete spinal cord injury, right? So that's a very quick test, but we do know the implications of that is that it is neurological. It is being carried by the muscles somehow. I don't know the exact kinesiology details as to what's happening in the arms and shoulders. So I'm not sure I can answer your question in that way specifically, but I'm like you, I feel it.
Mm-hmm.
And I know which direction it moves, so.
Yes,
yeah.
definitely. Thank you, and thank you for the spinal cord injury info. I hadn't heard that before.
Ah, you're welcome.
Yes. Hi. How are you?
I'm good.
Thank you so much for this class. So my question is this: in the example that you were discussing about for example, the jejunum, having a possible inflammation, and then kind of zeroing in on the immune cells. Can we then, as a practitioner, send an intention for the inner wisdom to initiate repair, for example, like through the glial cells, or is that also considered as, projecting an agenda on the body?
You can certainly work that way. And when Dr. John started working with the immune system, because he knew a lot of anatomy and physiology, he would often work that way, and he would make suggestions to the immune system. It's like, immune system, how about, could you send some particular cells over here, or could we get some stem cells to help repair this or whatever? And it worked.
Okay.
But he found that it was much more efficient to be a little bit more general in his attention, because the inner wisdom knows what needs to happen best, right? And I can put my 2 cents in, but I may not know everything that the inner wisdom knows. And so the most efficient way is simply to say, okay, inner wisdom, I recognize that you have a problem here, that you're showing me that there's some inflammation in the jejunum. What needs to happen, and how can I help you repair it?
Okay.
And the more that I can stay neutral and non-directive, the more it allows the inner wisdom to express itself directly. And it just turns out to be more efficient. I mean, I could do it the other way too. And the inner wisdom usually will say, yeah, okay, that's a good idea. We could try that. Sure, why not? But if I let the inner wisdom express itself more directly, I tend to get better results.
Correct. And that's, I guess, where also the SCR work comes in handy, because if in fact there is another layer of wisdom that the tissues have, then by beginning a dialogue about that actually might come to surface and in itself initiate the healing.
Exactly. And that's the goal. People often misunderstand dialoguing too. Dialoguing is not there to try to solve a problem and to fix things, right? Dialoguing is a tool that's best used to bring information to consciousness, to help the body and the inner wisdom and become aware of the problem. And once it comes to consciousness, then the inner wisdom says, oh, great, okay, let's fix that, cool. I don't have to go in and direct it. So certainly you can get away with being directive to some extent, because the inner wisdom will say, okay, yeah, sure, why not? But again, you get more efficient results by being neutral. Again, I come back to that analogy of me being the audience to the symphony orchestra, right? I don't play the music, I don't conduct the music. I simply listen. And the fact that I'm there being a witness and listening to this process is what enables the process to move forward. Does that make sense?
Yes, very much so. I really love that analogy. Thank you for that. And thank you for your answer.
Yeah, thank you. And Mika, just unmute you here. Misa, sorry, yeah.
Yes, that's okay.
Yes.
So, my question is a palpation, the immune system. And I assume that we can do anywhere in the body.
Yes.
But yes, and then if so, how about the joints, the bones? is there any difference that I need to be aware of when I, for example, try to palpate my right ankle, which has chronic, injury? I mean,
Okay.
Inflammation from the old injury.
Yeah, you can palpate anywhere in the body. There's no real difference in terms of what you would do from one part to another. The thing to be aware of is, and you would learn this in the basic immune response class, is that there are certain, as I mentioned, pathways where the immune cells normally travel and occupy. And those are in the blood, in the lymph, in certain immune organs, lymph nodes, spleen, things like that, bone marrow, but not in the tissue itself and not in the joints. So ordinarily there would be no immune cells in your joints. So and you could compare, if you have a lot of inflammation in your left ankle, but your right ankle's fine, you could compare, what do I feel in the right ankle? And go and see if you feel the presence of immune cells in that joint space, say in the synovial space of the joint. Probably if there's no inflammation in the right ankle, you'll feel nothing. So tune into the joint itself, you'd feel the joint moving in the cranial rhythm, tune into the immune cells that might be there, and you'll feel nothing because there's no immune cells there. Then compared to the left, you probably, if you tune into the joint, you probably find that the joint is not moving in the cranial rhythm because you have inflammation, it's stuck. But then you tune into the immune cells there, and you probably will not feel any cranial rhythm there either. Because if there's inflammation, if it's chronic inflammation, if there's a lot of immune cells there, they're not working properly, right? So you won't feel a cranial rhythm when you tune into the immune cells, but it won't feel empty, it'll feel stuck. So an analogy, if you're feeling the right ankle and there's no immune cells there and it's all fine, and you tune into the immune cells, this sensation I get is I don't feel any cranial rhythm, but I feel like I walk into an empty warehouse and I say hello, and there's this big echo and there's just nothing there. It's just empty. If I tune into the left side where there is chronic inflammation and I tune into the immune cells, I'm not going to feel them moving in the cranial rhythm because they're all stuck, they can't move. And the sensation is like being in an elevator with 20 people, so the elevator only holds 10 people. And we're all standing stuck together like this and you just can't move at all. And so you have to pay a lot of attention to the energetic quality of, okay, I don't feel any cranial rhythm. What does it feel like energetically? Does it feel stuck? Sometimes it'll feel collapsed, like they're exhausted. Sometimes they'll feel hypervigilant. They could be in shock. Any emotional feeling that a person can have as a human being can be exhibited on a cellular level within the immune cells, right? So you have to distinguish in the cases where I tune into something and I don't feel cranial rhythm when I tune into the immune cells. Am I feeling no cranial rhythm because there's nothing there? Or am I feeling no cranial rhythm because it's all stuck and it can't move? And that is something you would learn how to do in the immune response class. Okay?
Thank you.
Yeah, you're welcome. Thank you.
Hi, Tim. Thank you for this class. It's been really interesting. I have a question that's, I guess, come up time and time again. It's an immune question. My dad suffered from bacterial meningitis, and I was fortunate enough to get my hands on him within a few hours in the A&E, and I tuned into his rhythm. And I've been doing CST for about 6-7 years now, and I've never felt anything like it in my life. Like the rhythm was really quick, so the rate was really fast. The amplitude was quite small. Quality was quite robust and very symmetrical. But it almost felt like erratic, like his body was just on overdrive.
Okay. Did I understand this was your dog that you were palpating?
No, my dad. Sorry, my dad.
Your dad. Sorry. Okay. Yeah, sorry. I misunderstood. Okay, your dad. Great.
So, it was bacterial meningitis that he got through an ear infection.
Okay.
And, you know, I felt really great that I could help him. But it's just, I've always wondered why was the rhythm, why was I feeling that in the rhythm? Was it because the infection within the CSF? Was it just the whole immune response in the body? Like, so is that a normal immune thing, that if the body is really fighting something like that, that the immune system goes crazy and affects the craniosacral rhythm? Or
It's not a normal response to inflammation or infection in general, but I could see where it would be if it's in the central nervous system.
okay,
Because now you're starting to irritate and affect the circuitry that is controlling the pressure stat model,
yep,
and that can disrupt its functioning. And if you imagine if the tissue is very irritated and reactive, then normally the nerves that go to and from the stretch and pressure receptors in the sagittal suture,
yep,
if those nerves become facilitated, so they become irritated, they're not going to fire smoothly, right? So you're
Okay.
not going to get good signal going to the choroid plexus saying turn on, turn off. It's going to be erratic. It's going to be maybe happening too quickly because the nerves, if the nerves are facilitated, they're firing too quickly, too often. And so that
Okay.
could disrupt the rhythm in that way. That would be my guess.
Okay, no, that's really helpful. I've never really been able to work it out, and so yeah, that
Yeah.
makes sense in my head.
And whereas if you had an infection, even if it's involving the nervous system, if it's elsewhere in the body, and you know, I've got a nerve pathway that's facilitated maybe in my gut or something, or in the spinal cord, but it's not affecting the choroid plexus, it's not affecting those nerves going to the sagittal suture, probably you would not see that change in the cranial rhythm.
Okay, thank you. That was really helpful.
Yeah, you're welcome.
Yeah, can you hear me?
Yes, I can.
This is a pretty general question, but I have several friends that have cancer right now, and I would love to, I want to offer them a treatment just for relaxation or for whatever I can offer. But I'm wondering if you could just touch in on, and just give me a story about working on somebody with cancer.
With cancer. Cancer is something that Dr. John spent a lot of time working on, and he actually had a lot of experience with it. And there's several approaches you can do working with cancer. I think just helping someone to be, even just doing a 10-step protocol on someone, helping them to be more comfortable, helping the system to move more effectively, function more effectively within the constraints of whatever they're dealing with, can be enormously valuable. I have one patient currently who has colorectal cancer, stage 4 colorectal cancer, and she often is in incredible pain and has a lot of trouble sleeping and just functioning in general. And she comes and lies on my table, and her whole body is rigid and just, locked in this very painful syndrome. And 20 minutes later, it's all relaxed, stretched out, and her pain goes away. It's temporary, but it certainly helps her to deal with the cancer that she's experiencing. That in and of itself can be incredibly valuable. So, and you can do that just by doing a 10-step protocol on somebody, right? Doing a lot of still points.
Mm-hmm.
If you want to treat the cancer directly, certainly arcing for it. And okay, where is the cancer feel in the body? How does the cancer feel? Are the cancer cells moving in the cranial rhythm? Are the immune cells around the cancer cells, if there are immune cells moving in the cranial rhythm? A lot of times, immune system is not significantly involved in dealing with cancer, because cancer cells are your normal cells. They're reproducing inappropriately, and they've learned to produce blood supply and so on. But as far as the immune cells they are concerned, they look like normal cells. And so the immune system does not recognize them as being anything out of the ordinary. But one of the things that we can do with cranial work is to, as I said, using dialoguing or just using our intention, bringing things to conscious awareness and helping the immune cells to realize that, oh, this thing that looks normal, it's not.
Uh-huh.
And so this thing, we really need to do something about this. And there's a wonderful book, I forget the guy's name, but it's called, what's it called? Commotion in the Blood. And one of Dr. John's favorite books, there was a doctor who discovered, he was an oncologist, and he discovered that some of his patients, a small percentage of his patients who had stage 4 cancer, came down with some other very serious illness in the process of dealing with their cancer. And that activated their immune system, and then it got rid of their cancer. Just, it didn't happen very often, but it did occasionally happen. And he realized that if you can get the immune system activated and going on the warpath, and then get it to target the cancer, then you can have an effect on the cancer itself, right? And a lot of the modern biologic cancer treatments are focused on how to activate the immune system and get it to trigger and focus on the cancer cells. So we can do that through dialogue, possibly, or at least offer that as an option and see, immune cell system, would you be able to do that? Another option, if they're willing to go there, is to dialogue with the cancer itself and find out, cancer, why are you here?
Right.
And John had several cases where, cancer sometimes is there for no particular reason, right? You got exposed to a bunch of toxins and it triggered some chemical change in the DNA, and now you got cancer. There's no real meaning behind it. It just happened.
Right.
But it can also be a situation where there is some intention to the cancer. And, John had cases where the cancer was sort of egomaniacal. It's like, hey, I can reproduce forever and nobody can stop me, but there are also situations where the cancer could be the voice of the inner wisdom. Trying to get your attention. And he had several cases like that. If you read the green book on SCR, in the back, there's a long case where he talks about that, where there was a woman who had breast cancer, and John started dialoguing with cancer and said, cancer, why are you here? And cancer said, well, she's ignoring her femininity. This was that particular case. And I've tried everything to get her to make this awareness of this aspect of her life. She keeps ignoring it. I'm at the end of my wits. If she keeps ignoring it, I'm going to kill her. I don't care. And she was able to hear that and was able to start a dialogue with cancer. And she actually survived the breast cancer and was okay.
Wow.
So again, you have to find out, as I said, the thing to do with dialoguing is to help you to understand what's happening. Not to try to change it or make it be something you want it to be, but to understand what the situation is.
Right.
And in this case, dialoguing that John was able to do was able to bring this to the surface, and she was able to recognize it, and that was able to change the process of the disease. So many, many different approaches to working with cancer, and that you just have to try and see what works. But I think even if you can just do basic structural work on somebody, that can be very, very beneficial and very helpful.
Thank you.
Yeah, you're welcome. So actually, we have one more question.
Yes, hello.
Hello.
Thank you for doing this introduction. I really appreciate it.
Yeah, you're
You
welcome.
spoke about the network or web of the cells of the immune system. And I was just curious, how does that compare or correlate with the web of the matrix that Tad refers to in his Touching the Brain classes?
He's talking more about the glial cells that they act to support the nerve cells. So it's like the nerve cells are embedded in this web of the glial cells. They're still attached to each other. So that it's a much more dense web.
Okay.
The immune cells are spread out apart from each other and all over the place, basically. But they're communicating energetically and chemically with each other. So it's a much less dense, more spread out web, basically, if that makes sense.
Yes, it does. Thank you so much.
Yeah, you're welcome. Okay, looks like no more questions at the moment. Well, I'd like to thank everybody for listening to my little presentation. And hopefully this has piqued some of your interest in taking one of these courses. And maybe down the road, we'll see you in the immune response curriculum.